Good evening and welcome to our COVID-19 update. I'm Ladi Akeredoluale. Here are the highlights at this hour. Stakeholders in Nigeria's economy describe pains and potentials of palliatives to cushion COVID-19 effects on business. Some Cross River State residents express difficulty in complying to COVID-19 protocols as Niger State unveils plans to reopen schools. And South Africa mules possibilities of level 1 lockdown and its impact on economic activities. We begin from the nation's commercial capital in Lagos, that is. Remember, the outbreak of COVID-19 was traced to a major wholesale market in Wuhan in China. Well, the Lagos state government is working on ways of reducing the risks of spreading this virus by reviving the enforcement of the Lagos meat reform process. According to the state's acting commissioner of agriculture, Ms. Abisola Odusoya, the policy entails the closure of abattoirs and slaughter slabs which do not meet up with operational protocols, and also ensure that only safe meat is available in the market for the citizens.
The COVID-19 pandemic, or the virus as it started in Wuhan, China, in a wet market where they're selling meat. And if you also have illegal slabs, people's backyards where they are slaughtering meat and there's no vet doctor to certify, then what are we doing? We are killing ourselves, all in the name of, oh, it is the way they earn their daily income. It's just like you saying, oh, why can't NAFDAC approve for everybody to own a chemist, regardless of the fact whether those drugs are certified for good consumption or not? Then we might as well just let anyone run a chemist or a pharmacy and say, oh, after all, they are also earning their daily living. So we cannot keep using this kind of excuses to augment or to legalize something that is illegal. There are standards, there are procedures to having a slaughter slab or an abattoir. So long as you are within the confines of that policy, of that law, nobody will come near you. But if you are doing it in an illegal manner, then you don't expect us to legalize it, all in the name of, oh, that is the way you earn your living, or that is the way you see it fit to, operate your business. What can we do to ensure that at the end of the day we have a sanitized value chain system to ensure that the Lagosian gets a good quality meat at good pricing, and with the stakeholders also being able to maximize the benefits of the business they do within that chain. So one leg of it is the abattoir, which is where the monitoring, enforcement and compliance comes in to ensure that illegal slaughter slabs are shut down. Then the next stage within that bucket is to ensure that even the slaughter slabs that are government approved, are they also following procedure? Are they also following standards?
Acting Commissioner of Agriculture in Lagos State. Meanwhile, the butchers in Quarter Meat Market, that's in Anambra State now, are appealing to the state government to give them more support in order to enhance hygiene and safety protocols in their market. The market houses an abattoir that attracts customers from 7 neighboring communities and extends to Mpo and Onitsha, with over 30 cows killed daily, albeit that was before the COVID-19 pandemic disrupted business. The chairman of the Butchers Association, Obiora Onyechi, says they're working hard to improve sanitary conditions.
Quarter Abattoir is in a central location in Oka, the Anambra State capital. Constructed over 40 years ago, customers come from several communities around Oka and Mpo and Onitsha to patronize the butchers. The abattoir is demarcated in sections which include the pond area where the washing of the meat takes place. There's also a section for burning. Here, the butchers use only bamboo and not plastic or rubber products as a standard practice. Then the selling area where the customers can make their choice. But the butchers are not happy with the state of things, despite the amount being generated for the state.
Before we kick out, we have an veterinary, we have an emala. We will come very early and check the type of cow, the type of goat, the type of people. So we just taking our food very carefully.
Keeping the abattoir environment clean is their priority, and they are appealing to the government to construct a drainage network around them.
All the whole land is too dirty because we are doing our our own capacity to do the praise to be normal, but there is no money to continue the job. So that we need government to help us, especially to do gutter for this very praise.
The abattoir environment, no doubt, needs to be fixed, and the State Commissioner for Health says that the government is coming up with a modern infrastructure that will be a model for new slaughterhouses.
They have a large general abattoir. The animal concern rested, and the animal will be inspected by the veterinarians, and then the health officers will come around and inspect the animal during the slaughter process and make sure that the animal is healthy. And then the environmentalists will make sure that the effluents from that area, the waste products that are produced, are disposed of in a good manner.
While the butchers wait for the advanced abattoir to come to reality, they maintain that the earlier the government supports them, the better, because the resources they put into the running of the place is taking a toll on their business.
From Anambra to Cross River State, where in Calabar, its capital, residents are describing the constant use of face masks as uncomfortable. A visit to the popular wet market and Etim Edem Motor Park reveals that about 90% of buyers and traders don't have their face masks on. Some of them gave some reasons.
Actually, this fake masks is type by type. Some of them you can use it and speak very well louder. Just like this one, it's elastic. Then some of them you can use it, you cannot be able to speak, even breathe in, because you can suffocate anyone.
It's not easy. You just have to allow some air, you know. As you can see, I'm not even wearing one now. And then there's a cure. If you get sick, you go to the hospital and get treated, that's all.
We are not comfortable with it. We are not comfortable with it because it will block our nose. But we normally use it. Like me, I have it, but I don't use it now.
In the meantime, for the Cross River State government, modalities are being put in place for the compulsory use of the face mask, as well as other non-pharmaceutical protocols in public places as it continues its awareness campaign.
The garment factory has continuously produced masks in, like I told you, hundreds of thousands of masks monthly. And what we've done over time is we take those masks, we go out to rural areas, into urban areas, into the markets, and we distribute them for free. Human beings by default are social creatures. We like to be able to see each other's faces. So the nose mask is a bit of a discomfort for human interaction. Social distancing as well, because as social creatures, we like to be in each other's spaces. The average Nigerian likes some leisure activities, whether it's sitting at a bar, going for a wedding, going for some sort of social event. And so all these safety protocols have been a challenge to the normal functioning of the average Nigerian man or woman. That said, I don't think there's anything more important than life.
It's 6 months to the day today that the COVID-19 virus was declared a pandemic in terms of its spread. And schools, amongst other institutions, were shut worldwide to try to contain its spread. What with lockdowns easing up around the world, here in Nigeria, the Niger State government says that primary schools across 25 local government areas will reopen on Monday, the 14th of September, for pupils in exit classes. Emperor Simon in Minna tells us more.
The Niger State government says it is confident that pupils in exit classes in primary schools can now return to school, especially to write the National Common Entrance Examination. And that's after training over 3,000 head teachers from across the 25 local government areas of the state. This is a cheering news, especially that schools have been shut down for more than 6 months now. The chairman of the Universal Basic Education Board in the state says that without iota of doubt, the safety of the pupils will be guaranteed.
The reopening process has just begun today with the training of head teachers as sponsored by Universal Basic Education Commission in collaboration with Niger Subeb. As I'm talking to you, over 3,222 head teachers are undergoing training today and tomorrow for that is going to give a kind of a signal for opening of our schools. And I want to assure you that by next Monday, we are going to open primary 6 classes for examination purposes. However, we're not opening for all the students, for only candidates that we have registered for examination. We're opening for only the candidates that we have registered for examination. I can assure you that we have a maximum number of 500 children that will resume schools in various local governments. That is to say, in each local government there will be 20, and they will under the guidance and tutelage of their teachers for the purpose of examination. After the examination, we'll await the decision of Niger State Commissioner of Education on the matter of opening of schools.
Niger State currently has a total of 244 confirmed positive cases of COVID-19 with 12 deaths. At least over 2,000 suspected cases have so far been monitored by the state's task force on COVID-19. Emperor Simon for COVID-19 update.
Thank you, Emperor. The federal government, through the monetary authorities at the central bank, have since COVID-19 outbreak implemented some policies to cushion the effects of the pandemic on the economy. These measures were introduced by way of funding programs to span a period of time and are still going on as application seems to outweigh provisions.
Just like in other climes, it's been 7 months of COVID-19 pandemic in Nigeria, resulting in a severe stage of complete lockdown and a subsequent gradual resumption of economic activities. The effects of the pandemic plunged the economy into a record growth of 6% contraction. Ahead of the impacts of the pandemic, however, the central bank governor, Godwin Emefiele, announced certain measures to buffer the shocks.
All the Central Bank of Nigeria intervention facilities are hereby granted a further moratorium of 1 year on all principal repayments effective March 1, 2020.
These measures include the implementation of a 65% loan-to-deposit ratio across the banking industry, a 50 billion naira SME targeted credit facility, 1 trillion naira manufacturing sector facility, and a 100 billion naira healthcare industry fund, among others.
We need to prevail on Central Bank of Nigeria to extend its COVID-19 stimulus package to all manufacturers not covered by existing CBN initiative packages. We need to introduce fiscal measures by waiving import duties on active pharmaceutical ingredients, APIs, other essential products, and food-related raw materials for at least 1 year, effective from April 2020.
In its monthly economic data, the CBN reports that loans disbursements through its subsidiary, the Nerso Microfinance Bank, rose to 59.12 billion naira, with support for over 103,000 beneficiaries as at August 2020. On the part of the fiscal authorities, the government granted a 3-month repayment moratorium on the social investment schemes, initially suspended a hike in electricity tariff and petrol price, but has now adopted a market-driven approach for the products.
Let's talk about this to Dr. Muda Yusuf, Director General of the Lagos Chamber of Commerce and Industry, joins us via Skype from the Aropo area of Lagos. Good evening, Dr. Yusuf. Thank you for your time this evening.
Good evening, Ladi. Good evening. Good evening.
All these programs, you've been on this program before, all these interventions by the CBN and the other monetary authorities with specific reference to the economy. Has there been any major change between when last you were here to talk about this and today? Have, for example, more of your members in the LCCI, for example, had access to these interventions?
Yeah, thank you very much. There has been some impact, but the truth of the matter is that we need to relate the therapy or the interventions to the magnitude of the problem. Because the financing gaps that we are dealing with were so huge. For instance, in your report, you made reference to the 50 billion intervention fund and the fact that over 100,000 SMEs benefited. But if you look at the data from the National Bureau of Statistics, You have over 40 million MSMEs. So when you relate 100,000 to 40 million, you can see what percentage it is. So the CBN has been doing its best within the limits of its capacity. But we need to relate these interventions to the gaps that exist in the system. But the beauty of all of this is that, we have two major dimensions to the challenges and the shocks that we had in the economy. We had the global dimension, which arose from the collapse of commodity prices, the disruption in supply chains, the slowdown in the global economy. That took its toll on the domestic economy. We also had the domestic dimension, which has to do with the internal restrictions, movement, lockdown of sectors, interstate restrictions, and all of that. That also took its toll on the capacity of the domestic economy to function. So ultimately, even if you have the funding and there is no thriving economic activities, there's very little you can do with the funding. So what we are seeing now is that with the relaxation of some of these measures, both globally and domestically, economic activities are beginning to pick up. The tempo of economic activities are beginning to pick up. And some of the sectors that were badly hit, like the aviation sector, like the road transportation, construction, the hospitality, the entertainment industry, most of them contracted severely. From the reports we got in the second quarter report of our GDP. But with the gradual reopening of the economy, I think things will now begin to look up. We need to. We expect that.
Allow me to jump in. Allow me to jump in and ask that. Yes, it does look as if things are now looking up. And as you said, the impact needs to be related to the gaps that have been created. Two things have happened subsequently that's post this intervention programs. Electricity tariffs have gone up, fuel prices have gone up. Have we not erased the gains that these interventions may have had, even as limited as they are, by those twin actions?
You see, at a time like this, we must face the reality of the Nigerian economic conditions. This is a time for very difficult choices for government. There is no way we can have proper power supply delivery if we don't have a cost-reflective tariff. That is the reality. If you want private investors to invest in that sector, then the economics of the investment must be right. And that is the basis for the cost-reflective tariff. I take your point that, of course, it will bring some pain, some inconveniences, but I believe personally that in the medium to long term, it is in the interest of this economy to have a tariff that will attract investment. And we must also emphasize the fact that we need to also complement this with some other policies. For instance, issues of metering, issues of inefficiencies in the system and all of that. All these need to go together. But some of these reforms, painful as they are generally inevitable. The same is true of the fuel price.
I'm sorry, I have 1 minute. I'm sorry, I have 1 minute, and I need to get this in within that 1 minute. The other policies that we're talking about now, take foreign exchange, for example. The dollar has gone from 360, where it had been for so long. It's now hovering between, depending on where you go, 460 and 490. Again, difficult choice?
Of course, of course. The dollar is driven by the external factor. It's driven by oil. And we know what has happened to oil price. We know what is happening to oil output. These are exogenous factors that are not squarely within the control of government. And you can't give what you don't have. So that is why we are having all of these things. But we believe that with appropriate reforms, with appropriate policies, this will adjust better and the economy will return to a more sustainable path of growth and recovery.
In that case, Dr. Yusuf, we will have you back again sometime in the not too distant future to come and update us on how these interventions are working, of course, with all the factors that have newly been thrown in. But thank you for your time this evening on the program.
Thank you very much. It's a pleasure.
We'll take a break, and when we return from the break, we'll talk to an SME operator, someone who is actually in the trenches. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Let's talk now to the Managing Director of Arels Pharmaceuticals, Dr. Adesomi Popola, who joins us via Skype from Ikeja. Good evening, Dr. Popola.
Good evening, sir.
Are you one of the beneficiaries of the 100 billion naira healthcare sector reform? After all, you are in pharmaceuticals, which is one of the priority industries. What has been your experience with these intervention funds?
Well, I'd like to confirm that I'm one of the beneficiaries. I benefited from one of the commercial banks, and the money was disbursed recently through a commercial bank. But interestingly, it was a smoother experience compared to experiences with earlier facilities secured from banks. It's a smoother one, and the conditions given are better for the pharmaceutical industry. But what I've realized is that I'm one of the luckier ones. Not most industry, most of my colleagues benefited. They are still waiting for the green light. Most people are still waiting, and the conditions set by some commercial banks are not too good. So they are yet to assess it, but most people that have been given have successfully assessed it.
If you've accessed it, even though you've pointed out that there are others who haven't, how much of an impact is this going to have on things like your capacity to retain your staff and not to have problems in terms of being able to import the materials that will be required for you to re-energize your productive process, as well as contribute to national development in terms of payment of taxes and all that? The economic environment, let us put it that way.
Well, it has immediate impact on the capacity in terms of availability of funds to access some raw materials. But the major restriction has been the non-availability of foreign exchange. The funds are there, but the foreign exchange are not easily available. Hopefully, in the next few weeks, there should be foreign exchange availability, which will allow us to bring in the equipment and the raw materials that we require to scale up our capacity.
The other question then will be to look at this in the broader sense of the health sector generally and the role that that sector should be playing at this point. Everybody is in the pursuit of a vaccine or some kind of pharmaceutical intervention. You run a pharmaceutical company. How has the process been for you? Are you participating in this? Is the industry participating on a global level or even at a national or sub-regional level?
Well, I would like to say that the industry is participating on regional or national level. But global level, we are far, far, far down the road. Why? The raw materials are not easily available for us, and we are yet to start manufacturing the active and scan ingredients. These are all imported. The equipments are all imported. This needs time for us to get to that point where we can manufacture the active raw pharmaceutical ingredients and the excipients. Once this is done, then we can say we want to compete globally. But I'm aware that federal government has also planned to release additional funds to support the pharmaceutical industry to scale up capacity in research and development. This will go a long way. It will go a long way to put Nigeria on the global scale. Once we are able to manufacture vaccines and other very technologically advanced products, then we'll be able to compete globally. Hopefully, the other infrastructures that are meant to support all this will be available, i.e., constant power availability.
I'm happy you mentioned the question of power because that was going to be my next question. Foreign exchange. I was speaking with Dr. Muda Yusuf before you on the program this evening, and I asked the question that even with the interventions that have been made, electricity prices have been increased, fuel prices have been increased, foreign exchange rates have gone up all within this period. Are these hindrances, do you think, to the process of you being able to scale up and participate as you have indicated?
Yeah, it's a major contributor. Once you can get over this, then you can contribute fully. But once the foreign exchange is not available, you have the funds in Naira, but you can't get the foreign exchange. What do? You only look at the funds until you start paying down the loan. And as per power, I believe there's little you can do now that the tariffs have been increased. But the most important thing is availability. If it's going to be available regularly, then there won't be any need for us to buy diesel at a very expensive rate. But even at a very high tariff rate, the power sometimes are hardly available. Very unlike other advanced countries where they are assured of regular power supply and they can plan. They can plan with the availability of power. But here you have to match both the diesel with electricity from government, and this also brings down some of the interest, the profitability that we are able to experience. But with low interest rates, I believe it's going a long way to improve our capacity, and to also improve the ability for us to retain and increase our staff levels.
I have one more question for you, and I have a minute for you to answer it. As an insider in the pharmaceutical industry, from what you are hearing and from what you know, how far away are we from a COVID-19 vaccine?
Oh, you mean in Nigeria or globally?
Globally, and even in Nigeria.
Well, globally from what I read, first quarter 2021. In Nigeria, we need to ask God for support because we are far down the road to COVID-19 vaccine in Nigeria from insider information.
All right then, Dr. Adesomi Popola, Managing Director, Rails Pharmaceuticals. Thank you for your time on the program this evening. It's been a pleasure having you.
You are welcome.
2 new laboratories have been activated for inclusion in the NCDC Molecular Laboratory Network. These are the Test Tube Federal Medical Center Gene Expert Laboratory, Burning Kirby, and Test Tube Plateau State Human Virology Research Center in Plateau State. This puts the total number of labs completed across the country at 71. As of today, only 35 states have been added to the NCDC Molecular Lab Network, with the exception of Niger State. Also, as of today, Nigeria has tested 436,231 samples of COVID-19, confirming 55,082. Almost at 44,000 the number of patients who have recovered, and 1,075 deaths have been recorded in 36 states and the Federal Capital Territory. 5 deaths were recorded in Nigeria last night, and 197 new cases reported by the NCDC from 13 states, with Plateau leading at 83, followed by Lagos with 48, Kaduna at 17, the FCT 16, Ogun 11, Katsina 7, Imo 4, Edo 3, same with Nasarawa. Rivers had 2, and Bayelsa, Oyo, and Osun had 1 each. According to the Africa Center for Disease Control and Prevention, COVID-19 update in Africa shows that the numbers have climbed and are now at over 1.3 million. Total deaths have also risen to 32,117, and recoveries are at 1,068,493. Outside our shores, South Africans are eagerly awaiting a shift to less lockdown restrictions within next week. President Cyril Ramaphosa told the South African National Editors Forum today that the National Coronavirus Command Council is evaluating a number of proposals around the further easing of lockdown restrictions in the country. The National Cabinet has also announced the extension of the national state of disaster by another month. Joined by other world leaders, as well as the UN Secretary General, President Ramaphosa co-chaired the WHO's Access to COVID-19 Tools Facilitation Council virtual meeting.
On Thursday, President Cyril Ramaphosa of South Africa along with the Norwegian Prime Minister Emma Solberg, co-chaired the WHO's first high-level meeting of the Facilitation Council of the Access to COVID-19 Tools Act Accelerator, which is an international collaboration among diverse representation of global leaders and partners to accelerate development, production and equitable deployment of vaccines, therapeutics and diagnostics for COVID-19.
We now have to speed up the process of finding tools to combat the pandemic. It is essential that humanity should have a sense that if and when a vaccine is developed, all countries, including my own continent, Africa, should benefit and not be left behind.
We're now in the process of establishing a consensus on the international allocation of these products. But the ACT Accelerator will not be able to deliver on its goals without a significant increase in funding. Bilateral vaccine deals and vaccine nationalism could compromise equitable access and hold up progress for all countries in bringing the COVID-19 pandemic to an end.
Meanwhile, British drug maker AstraZeneca is pausing its global trial of the potential COVID-19 vaccine, Chadox-1 nCoV-19, has also put on hold its trial in South Africa, just like everywhere else. But some of the country's 2,000 volunteers say they're not worried. On the news making the rounds about the COVID fatality figures of Nigerians in South Africa, the Nigerian Consul General Godwin Adama admitted that there are definite fatalities, but an official tally may be difficult to confirm.
Of course, some Nigerians have died in the process, like South Africans and others. You can see the figure is quite high here. The way it is done in this country, the only person that could know that a relation had died of COVID may be the parents of the relation themselves. And I don't think they are very willing to reveal.
South Africa's cabinet has extended the national state of disaster for another month, and with the country's recovery rate going further north to 88.7%, there are expectations that President Cyril Ramaphosa may address the nation in a few days, armed with a further lifting of lockdown restrictions. From Johannesburg, South Africa, Betty Dibia for the COVID-19 update.
Let's talk now to Betty. She joins us from South Africa's commercial capital, Johannesburg. Betty, nice to see you. What does this level 1 lockdown mean in practical terms if it happens?
Yes, if it happens, that's the operative word. That means more sectors that are still left out, like events people, even churches. These are part of the proposals that the president is, or the command council is evaluating, increasing the number of worshippers at worship places, mosques and churches, the events people, the entertainment people, tourism as well, aviation sector, probably opening up for international flights. I know that the transport minister, Fikile Mbalula, is inspecting some of the major airports, but that is what we've been told is that it's for to look at complaints or examine the complaints that a lot of people have sent in regarding compliance. Maybe he'll be looking into preparedness as well for probably international flights.
The other thing here is that there appears to be good news. Recovery rates are rising, fatalities are reducing, but everybody is still talking about being cautious. Try to marry both. Try to marry both for us.
Fatality figures are still there. I wouldn't say going down. Like overnight, from Thursday to Friday, we have 113. We've had 100 plus, 100 plus. That's quite high, compared to what should be, especially for just one particular disease, or if I'll call it that. Recovery rate is heading towards 90%, and that's good news. The issue of fatality, the caution is just the word that everybody should watch out for. We can't afford generally, globally, to just relax. Oh, these numbers are going down, and people should just go back to normal. We know that the experts have said that COVID is here to stay for a long time to come, probably a year or two more. So it's not rocket science that people have to be cautious at all times, everywhere they are.
The extension of the state of national disaster, what does that mean? What's the ramification of that?
The state of national disaster is the part of the law empowering the government to curb the freedoms of the people to move around and do just about anything, of course, legal. But it's only permitted, the government is only permitted to move it, for after the first extension for just a month. So you see the president has been moving it, or the command council has been moving it from 15th to 15th to 15th to 15th. So 15th of October is where we have, that way you can still have a measure of lockdown. Probably we go to level 1. That means not totally everything is permitted. You can have more than 50 people or more than 100 people at a funeral, for example. So for you to be able to do that, that means that law, that part of the law has to be in place for the government to have the power to restrict people somehow. Maybe not as bad as level 5, but at least a measure of restriction, on some of the freedoms of the people. And that's been extended to the 15th of October.
One final question, and I think you've got a minute to give me an answer to this. The big meeting, the virtual meeting that's just happened, which President Ramaphosa presided over, having to do with the access COVID-19 vaccine program. Is that really something that people are buying into, do you think, in that country?
I guess it's still top level, as they called it, the high level meeting. But these are conversations that happen between governments, just collaboration, governments and the experts, other experts or partners, as they call them, to be able to facilitate some of these tools that people can use, or governments, maybe not so prominent countries, can use to help their own countries, just to ensure that everybody has access. If there's success somewhere, to be able to have access to the successes to help facilitate success elsewhere. So I don't think it's still at the level of the people, but it's government to government and government to partners, as well as the WHO, of course, and the United Nations.
All right, then. Thank you so much, Betty, for the reporting tonight and the updates. Do continue to stay safe out there.
Thank you. You too.
Scientists advising the United Kingdom government say COVID-19 infections are beginning to spread more rapidly across the country. For the first time since March, the R number, which measures how many people one patient infects, is above 1. A study of thousands of people in England found cases doubling every 7 to 8 days, with a marked rise in the north and amongst young people. New laws on how many people can socialize indoors and outdoors are being introduced from Monday. Here are other developments on our COVID-19 update.
The World Health Organization and the Africa Centers for Disease Control have launched a new laboratory network that will reinforce genome sequencing of coronavirus in Africa. The initiative seeks to study the possible mutations of the virus in order to prepare better responses in the public health sector. Experts from the WHO and the Africa CDC believe that the move will help countries understand the different strains of the SARS-CoV-2 virus in order to improve the country's responses, treatments, and possible vaccines, and make them more relevant to the continent's population. Meanwhile, WHO Chief Tedros Ghebreyesus is calling for solidarity among nations and global leadership to defeat the pandemic, adding that divisions will only give the virus an opportunity to spread.
So I will again remind, we will need solidarity and we will need global leadership, especially of the major powers in the world. That's how we can defeat this virus.
Elsewhere, France is planning tougher measures to combat coronavirus after experiencing a record number of daily cases. The country registered 10,000 new cases in a 24-hour period, according to Thursday's figures. The head of the Scientific Council advising the government on the pandemic, Jean-François Delfraisier, has warned that tough measures will be required. And in Asia, India's COVID-19 situation continued to worsen on Thursday as the country reported as many as 95,735 new cases during the past 24 hours, bringing the total tally to over 4.4 million. It's rewriting the world's record of a single jump of COVID-19 cases in one country. Earlier this week, India overtook Brazil to become a country with the highest number of coronavirus infections in the world, only after the United States. And finally, Thai authorities have stepped up security and mandatory testing for residents and migrant workers in border towns as a new wave of COVID-19 infections surges in neighboring Myanmar. Dozens of migrant workers from Myanmar received COVID-19 swab tests and mobile testing centers in Western Tak Province. Authorities started conducting mandatory testing for border residents and migrants at least a week ago.
That's our COVID-19 update for tonight and for this week. You can take a closer look at some of the numbers as well as the stories by visiting our website, channelstv.com. There you have all the details and everything you need to understand to stay safe during this period. Of course, there are other stories on politics, business and sports, amongst others. We'll have a fresh package on Monday at noon, followed by the updates at 6 and 9. Thank you very much for watching. I'm Ladi Akari Duluale. Do have a nice weekend and do stay safe.